Generosity New York is a group of Christians spurring on one another to experience philanthropy differently. With more joy, more wisdom, and doing it in community, which is rare. We deliver events, content, and counsel. Events that are inspirational, educational, and safe. Not meant for solicitation. This is meant for learning and being inspired around your own generosity.
Started. We've got a lot of amazing things to cover today, but I do want to just welcome you all, as you arrive here to another Generosity New York gathering. Obviously in this season, our gatherings look a little different, but the reason we gather remains the same. We want to spur each other on to do philanthropy and generosity differently. We want to encourage each other, challenge each other, and continue to learn and grow, and especially in this season, connect in community, because we really believe that that's God's best design for stewardship and pretty much everything else. And so it's a challenging time for traditional community, but we're grateful for the technology and the commitment of people to continue to meet. And so today we just have some, I think, really exciting conversation to have around what's happening right now with the COVID crisis, particularly in the healthcare arena, and how what's happening on the front lines and how people are supporting that work, and the people who are fighting those battles. At this point, again, I'm just going to remind everyone, if you could stay muted while we have this, while the presentation happens, and then we'll have some time for Q&A towards the end. That'll help us. But I want to introduce our moderator today. He's a good friend. His name is Gregg Roberts. Gregg's an entrepreneur who has founded and operated a number of businesses in and around New York City, including an upscale boxing club. And I think for my family, that's particularly compelling. We've been watching all the Rocky movies in our quarantine. But he's also owned a commercial real estate company in New York and oversaw the ground-up development operations of 10 retail food stores. And he recently co-founded a nonprofit medical and wellness center and is involved with developing an affordable co-living residence in Midtown Manhattan. He's been responsible for navigating companies of 25 to 200 employees through some very challenging times, including one which was 4 blocks from ground zero on 9/11. He's also a published author and attended the Harvard Business School's OPM program. And currently, Gregg is the president of Simple Wisdom Wellbeing Solutions. He's facilitated numerous corporate wellness trainings around the country, including working with Sony, Spotify, and Verizon. He's a board member of the Stand Together, Make a Difference group, a community coalition whose mission is to promote awareness in order to help prevent substance abuse and addiction. So Gregg has become a good friend. He's a member of Generosity New York, and we're glad to have you here kind of hosting our conversation. Gregg, I'll pass it to you now.
All right. Thank you, Tim. And thank you, Jeff and Kristen, for putting this together. The events are great, and look forward to the 3 special guests we have today. Just a little bit more about my background and where I pivoted. I had more of a conventional background until about 10 years ago when I decided to pivot. I kind of felt led to pivot into wellness and health. I felt called to help people. I'm particularly passionate about the chronic illness epidemic that we have in our country and around the world, and understanding how preventable that is. So about 10 years ago, I started to walk away from some of my more conventional business ventures and turn my attention towards that, which leads us to where we are right now in this current epidemic. I do see through my wife particularly, who is a physician as well, like the Kims, some of the challenges that are going on right there that we're facing amongst this. And, where there's a lot of fear, maybe some misplaced, maybe some very real. There's also, we're finding shortages of kits, as we all know, shortages of supplies. Thank Sharon later for her great contribution there. So there's, we're in the midst of this. And there's a lot to talk about and lots to, I think, understand and suss out. So really looking forward to hearing from the pros and the special people we have on this call. We're going to start out with the Kims. Dr. David Kim is the Chief Executive Officer of Beacon Health. which is New York State's first faith-based federal and state certified nonprofit health center. They're located in Staten Island. And we're going to follow with Janet after that. And Dave, I just wanted to start with you, just curious, the genesis of Beacon Health being a faith-based medical facility. What was behind that? What does that look like on a day-to-day for you? How does the faith manifest in your day-to-day work?
Well, I guess that's a good place to start. Greg, I really wanted to thank you and Tim and Jeff and Kristen for inviting us back. We so enjoyed our time last time with Generosity and Wine, and we're glad to be back to share what's been happening to us at this point. In short, I'd say that Beacon's mission is to honor God by caring for the physical, mental, emotional, relational, and spiritual health of our community. We really try to practice, God's version of whole person care. I know there are a lot of definitions of whole person care out there, but we really try to apply a biblical principle of what it really means to heal people. And we do this through 4 different, what we call faces or windows through which Beacon looks out at the world. We look at it obviously from a patient-facing side where we're taking care of patients, both outpatient and inpatient in the hospitals. We're doing that even up to this moment. We give them not just the physical and mental and emotional support that they need for their disease conditions and so on and so forth, but also, make sure that their faith, if they have one, is tied in. And of course, we apply our faith to situations as appropriately as we can. So the patient-facing side is one. Then there's a colleague-facing side where we're also encouraging and teaching and training fellow residents, students, attendings, people who come into our sphere who are looking to see what it's really like to, at least see one example of what being a Christian physician is like. The third phase is our community. We're very into our community. We apply a Jeremiah 29:7 to seek the shalom approach to our community. Seek the shalom of the community that is entrapped you, and pray for it, for in its shalom you shall have shalom. So we really have interacted a lot with local political as well as community leaders in terms of making sure that we're contributing to the overall health of our community. And then finally, we speak in the public square from time to time. We make sure that on positions that we believe God has some kind of say in, that we're able to try to present as biblical a view on it as possible. And, we've spoken up in Albany, down in Washington, D.C. On some of these issues. And really all this is in support of our vision. So we said that our mission is sort of the what we do, right? We honor God by caring for the physical, mental, emotional, relational, and spiritual health of our community. The vision, or the why we do it, is because we truly believe that whole person, relationship-based healthcare has the power to heal people, transform communities, and ultimately change the spirit of America. And we take that vision very seriously as we go and do what we do.
Thanks, Dave. Yeah, and I as we transition maybe into the COVID stuff right now, first and forefront on a lot of people's minds. I heard you say something on a podcast that I really that really struck me, and I appreciated it. And it was around the fear almost of this epidemic being almost worse than the virus itself. And I wondered if you could speak to that, because we hear so much as far as the news and different news sources, and even the medical professionals are sorting out all the facts. And we know that, I hear from my wife particularly that for every one person that is identified with corona, there's at least 7 or 8 that are not, perhaps higher. So we know from that denominator standpoint, the fatality rate will probably go down when all the numbers are put together. But could you talk a little bit more about that, the fear versus the fear almost being worse than the actual virus itself?
Sure.
Yeah, I mean, we recognize that the statistics are pretty bad. But even with the statistics being what they are, we have found that the fear is worse than the disease. And we found that really by good education, but also putting it in perspective is really part of what we found has been the message that we've been trying to share. So with what we've been seeing and being a part of in our response here is utilizing our platform, being here in our community, and really feeling right now that we are really living up to our name in terms of being a beacon in our community. We've looked at how God really has prepared us, even when we really didn't know it, because of what experience we've had in the past. We were one of the primary dispensing locations for the H1N1 vaccination campaign, distributing 3,000 vaccines to individuals in Staten Island and pretty much all over the New York and New Jersey area. And then also in our work with Hurricane Irene, as well as Superstorm Sandy, we really learned how to respond in an emergency very quickly. And so that all prepared us for where we are now and being ready to respond to continue to provide care for our community here. And so for what we have been doing here is to continue to be that beacon and trying to maintain our operations as much as possible, being able to keep our doors open and still be able to provide patient care, but also being available to help to screen people, to also help to test, and as well as to help to diagnose those who are presenting with symptoms that are suspicious for coronavirus. And then that's actually what's led to our protocols, which we now call the 4 T's, which the 4 T's stand for to test, to treat, to track, and then also to teach. And so you were relating to the idea that fear is so much worse than the disease. That's part of what in our teaching aspect that we talk about, how they can not only protect their loved ones and also be reminding of how to self-quarantine in a home that may not have the space and the resources to quarantine as much as we would like, but how they can also continue to care for one another and to try to minimize spread.
Right. And also, it also helps to socialize with these patients. A lot of these patients are isolated in their own homes. We have patients at the health center that have not come out of their homes in the last 2.5, 3 weeks because they've been so scared. So in being able to follow up with a lot of these patients and their families directly, and we do daily phone calls with a number of our patients who are sick. And just in doing that, we've been able to really provide a very personal, relational approach to helping these folks and their families, cope with the manifestations of the disease that they're dealing with.
Yeah, there's definitely a lot of help needed out there. And even I was surprised for clinics and providers right now. I'm hearing through my wife and friends of mine that are in the medical field that ERs are even, their numbers are way down. There's budgetary concerns because a lot of people aren't even seeking some of the basic care that they need in fear of going outside. Have you seen that played out with your practice?
Oh, absolutely. We've seen it. We actually have seen it play out a lot, which is one of the actual reasons, as Janet mentioned, we stay open because, we can follow up with people, just because we're in an age of coronavirus, it doesn't mean that strokes don't happen. It doesn't mean that heart attacks and diabetic crises don't happen. Early on in the crisis, I would say, early March, we actually had a patient admitted for a massive stroke. The patient waited 2 days before going to the hospital. We could have intervened sooner had she not been so afraid to go, but we didn't find out about this till after she was already intubated. Turns out she was the only the only coronavirus negative patient in the intensive care unit. And it was just on the one hand, it was very unfortunate. On the other hand, God gave her and the family a lot of grace. She actually recovered pretty amazingly given the way she presented. And she was actually extubated and we were able to send her home. That was a very fortunate sort of this was God moment because, the CAT scan did not indicate that she was going to do that well. So, but yeah, we've seen a lot. That's just the most dramatic example of what we've been seeing.
Mm. Janet, could you talk a little bit? I noticed in your profile, you have a degree in bioethics. For some of those of us on the call here, could you expand on that a little bit, what that is and what that looks like for you in your role as Chief Medical Officer, how that plays out?
Yes, well, I had the privilege to study over at Trinity International University, which is part of Trinity Evangelical Divinity School. I was part of the inaugural class of their Master's in Bioethics program, which at that time was the only Christian or any faith-centered bioethics degree program that really looked at the different ethical issues that we all face with, either personally or professionally. And what is very unique about their program is that they really approached it from a from a Christ-centered perspective, but also looking at how do we communicate a Christian or Judeo-Christian centered ethics in a secular or in a public square type of setting. So I find that I use those that training in various different clinical experiences, as well as the just even whether it's the day-to-day clinical experiences that we've experienced as a clinician, or even just now with some of the different ethical issues that do come up, and that I'm sure all of us have heard about with how we are all responding to this current pandemic.
And what was it that drew you to bioethics? Had you had someone that led you there? What developed your interest in pursuing that particular field of study?
Well, yeah, it was such a new program at that time. This was actually in the late 1990s. But there's been a lot of literature in the ethics and bioethics literature, not as much from a Judeo-Christian standpoint. Most of the ethics literature was either from philosophers. You'll see some people who are secular thinkers, and some who are also just in the medical field themselves. But the whole genre of bioethics was a new field at that time. And it happened to be kind of a God thing too, and that a former youth pastor of mine, while I was just finishing college, mentioned you've got to meet these individuals, and if you're going to go to medical school, you should really see what they're doing. And I had the opportunity to do a lot of these studies that they talk about bioethics during med school, but we get like 1 or 2 lectures on it. And for me to have the opportunity to have spent a whole year working with theologians, as well as thinkers in the Christian world, as well as those that are involved in the public square from a Christian perspective, was very life-changing, something that I never looked for, and I'm extremely grateful for that opportunity.
So you were kind of found and led into that, it sounds like. How are you experiencing and other medical professionals right now, just the overall challenges, and what do you see going forward as far as, not to just throw the crystal ball in front of you or anything, but the next 2-3 months playing out, what are the biggest challenges now that it seems like some of the test kits are starting to arrive? But what's the general consensus around most medical professionals? And is there a division? You guys are faith-based medical professionals. How are you seeing what do you see like the next 2 to 3 months looking like?
Ooh, that's a tough question to answer, in the sense that we really still don't know fully everything about this particular virus. We don't really fully know how it's going to finish playing out here in New York. We do know that there's some places like New Orleans where there seems to have been a significant statistical decrease in the cases and the deaths, but it's too early to tell, honestly, what's going to happen. What we do know is that this is going to be a marathon. This is not going to be a sprint. It's unlike any other mass casualty situation I've personally ever been involved in. I was involved a little bit with 9/11 when I was younger. Obviously we were involved with Sandy very intimately, as well as H1N1, but they were all sort of one-off type events, right? The event happened and then there was recovery afterwards. Here, we're seeing this event kind of lingering and going on. And, yesterday, Cuomo had just mentioned that he was going to extend the social precautions yet another month. So, we've been telling everyone, in particular our healthcare professionals, we've been telling people to prepare for a marathon, make sure you have reserve. We've been mentoring and teaching a lot of the residents and students lately and just how to stay resilient and maintain their reserve, especially as we face, what is still a relatively unknown situation. But it's also given us an incredible opportunity to speak into the lives of a lot of residents and students. I spoke last week to about 60 residents at one of the local hospitals, whose hospital administration had actually asked me to speak into their increasing burnout and depression rates. And so we had a chance to actually share the gospel with 60 people who were very receptive to hearing somebody from a faith-based perspective, recognizing that faith actually does have to play a role in our resiliency and in our response to this and other situations.
Yeah, it's astounding. I mean, going into this crisis, just hearing about the challenge of medical providers, we see the stats of suicide and depression that, of course, being married to a physician, I like to get airtime because it is serious, and the constant stress and the administration now that's so cumbersome and challenging. So I can imagine now with all the extra burden and maybe less resources, the extra stress that it places on you guys as providers. And on that note, please share with us, how we can be praying for you during this and for the people you work with. If there's anything that we can, that comes to mind for you. I want to ask both of you too, when you look at different responses around the world and the different disparities that we have, like you look at Italy and the high fatality rate, and some of these fatality rates are obviously getting sussed out, as we talked a little bit about earlier. How do you explain some of the differences there to people when it comes to the variations in these death rates? Or to add on to that, we see like in Sweden, some countries are taking some different approaches. Maybe too soon to say see how they're going to play out. Sweden supposedly is adopting some of the herd mentality. I don't want to put any words in the mouth of the health officials over there, but there's different approaches. How do you explain just some of the differences out there? Start with the fatality rates in different countries.
Yeah, so I've done as we were developing our protocols, we actually looked at Italy, South Korea, Spain. We looked at pretty much every major country that was being highlighted. We sought a lot of help from friends that we have in the WHO and the CDC, who gave us a lot of guidance as we were developing our protocols here in New York. It's a very, very complicated question. Probably too long to try to answer in 1 or 2 minutes, but I will say that there are definitely cultural issues. I think there are population-based issues that relate to this. Italy, for instance, has a much older population on average than the rest of Europe, with a lot more comorbidity in general. We think that might have played a role. In places like Korea, for instance, the rates seem to have been lower because, South Korea just really jumped on top of this and tested and treated and tracked just about everybody that they could get their hands on. So that's sort of driven how we've done our testing and tracking protocols, because we basically borrowed our testing and tracking protocols from South Korea. We borrowed our treatment protocols from Spain and Italy. Spain mostly because they've had some antibiotic-based protocols for the pneumonia part of this disease that seem to have worked to temporarily decrease the death rates there. So we've been borrowing from all over. I think the key thing that Janet can elaborate on is that coronavirus is really a great imitator. It imitates a lot of other diseases. It does not manifest sort of in a classic manner. There are some patterns we've seen, but there's really nothing specific to identify this as, oh yes, coronavirus. So, Janet, if you want to quickly expand on that.
Yeah, and I also did want to talk about too that, just going back to Greg, the questions you were asking, I think that for me, I think the lowest point that I felt early on with this is feeling utterly helpless. That we had patients coming and I knew that there was something wrong, high probability they probably had coronavirus, and I had nothing to tell them to do. And so a lot of the therapies that we're all hearing about, they're still all experimental, and access to hydroxychloroquine is extremely difficult. And knowing that there are patients who depend on it for their own chronic diseases, talking about an ethical issue, I felt that was not, I can't jeopardize another population of individuals in the name of another group. And so for me, I had a few kind of coming to Jesus moments early on in this pandemic, and that was one of the most difficult points that I felt. Everybody who wants to go into healthcare, if you ask them why are they going, the first reason they're going to say is, well, I want to help people. And here I am in a situation where I have nothing to tell them except just take some Tylenol and we'll pray for you, which is a good thing to say. And we do say that to our patients. And we also offer that for our staff too. But there was nothing tangible that I felt that I could give that really would work with some certainty. And so I think that's something as staff, I think as they're coming through this peak and as we really adjust to living in a new normal, there's going to be a need and a space for a lot of these health professionals to be able to process what they've gone through. They went from a peacetime situation, to take the military analogy, to a wartime, literally not even overnight, maybe in hours. And unless you are prepared, you know, at least when the military, you know that you're going to war. Here, there was no announcement until after we were already in it. And I think that's part of, I think, the shock that I think some people are going to be coming out of. The other thing too is that as we've been really aggressive in testing, we found that our area in Staten Island was actually one of the least, had the least positive cases. And we thought, well, that's a good thing. Normally we would think that way. And one of the things that I've realized from my reading things from a public health standpoint is you actually are needing to look under the hood of why somewhere might have least positive cases. And one thing that the news stories, we're always, when we're hearing the news, if we hear of some certain number of positive cases, you always have to look at the denominator. So if the number of positive cases are 100, but your denominator's 100, that's one thing. But if your number of positive cases is 100 and your denominator is 100,000, that tells you a different story. And so what we found was our area wasn't getting tested enough. And so with efforts that we were able to do, really by the grace of God, we actually just recently saw from an epidemiology standpoint that our zip code where we're located now has the next highest level of positive cases in our area, which is more the lower socioeconomic part of the Staten Island. And at first I was very happy, but I mean, I shouldn't be happy about all the positive cases, but I felt that we were accomplishing our goal to keep testing more in order to identify the positives, to get them isolated, to get them self-quarantine. And we all know that that's what's going to help limit spread. And as we move forward into how we adjust to life, as we all come out and try to get back to normal, that has to be a key point, a key part of our any intervention.
Yeah, and just to wrap this part, because I know that time is coming up of the essence, but you know, the amazing thing is, of all the patients that we've treated under the protocols that we've had, including personal follow-up and all that, by the grace of God, so far we have about 70 people plus that we've called on a regular basis since we started doing this program. And so far, thank God, not a single one of them's gone to the hospital. We've had a bunch of near misses, but no one's actually gone to the hospital. And that's pretty miraculous in and of itself. But please continue to pray for us in that regard. Pray that we continue to be salt and light to this patient population. Pray particularly for the healthcare workers, particularly for the residents and students. I mean, we see these guys every day as we're rounding, or talk to them every day as they, you know, run consults by us. And, you know, it's very draining on them. I think Janet's already talked about how draining in general this marathon is going to get before it's over. So pray particularly though for the residents and students. We're doing a lot of mentoring on the fly with them, sort of in the war zone, if you will. So pray that we will be able to continue to give them the encouragement and real-time experience that they need. And then obviously just pray for everyone that's sick. I mean, you know, whether they're in a hospital or whether they're at home dealing with some of the more mental, emotional, relational, or spiritual aspects, you know, this is going to hit everyone. I mean, I think this is the first thing in my lifetime that has really succeeded in stripping away everyone's sense of security and stripped away what everyone thought they could find their foundational security in. So, you know, pray that you know, we continue to be in a position to minister in the midst of this crisis to those fears, those concerns, and to those people.
Well, thanks very much. We will be praying for you. Thanks for your courage, your patience around all this, the wisdom. We have a lot of questions coming in. If you guys are able to stick around for the Q&A in a bit, we would love that.
Sure.
Particularly around mental health, which we'd like to check in with you guys about. But for now, we're going to keep it moving. We're going to introduce Sharon And Sharon is the CEO and founder of Grace Farms Foundation. Their mission is to advance good through the engagement with nature, arts, justice, community, and faith. Sharon's organization really came to the rescue. They supplied 150,000 N95 masks, I think initially. Sharon, you'll have to correct me. And then another, what did I read, 130,000. They've deployed over 1 million PPEs, personal protective equipment there. So, Sharon, that's just amazing to see that kind of generosity and mobilization come together. And I wonder if you could just talk a little bit, well, first talk to us a little bit more about Grace Farms and incredible things you guys are doing. And, there's all these awards that I know when it comes to the architecture, the beautiful place I have not yet visited in New Canaan, but I hear it's a gorgeous facility. So if you could tell us a little bit about Grace Farms, but also what that effort looked like to mobilize, to get over 1 million PPEs out there in such a short amount of time. So welcome, Sharon.
Oh, sure. Well, thank you, Greg. And thank you, Tim, who's on the line as well, for just for allowing the generosity of New York colleagues, for this invitation to share a little bit about Grace Farms and how we pivoted from if you've been to Grace Farms and Grace Farms, we pivoted to being able to respond in real time in Connecticut for the COVID-19, where the COVID-19 epicenter is here in Fairfield County. So first, before we even begin, I want to just extend my appreciation to both David and Janet. You're there on the front lines as well. Just really incredible to hear your story. This is really why we pivoted. So you're exactly why. And we really do, extend our prayers and our heart goes out to all of your colleagues, your staff, and all those that are affected in your area as well by the COVID crisis here. So just to start off from the top, I am the CEO and founder of Grace Farms Foundation, and we did recently launch the Grace Farms Relief Fund for Connecticut, and also in tandem, the Grace Farms Alliance Against COVID-19. So I thought it might be helpful, Chelsea Thatcher, our CMO, is online, and thought it might be helpful to be able to see a little bit, you're asking like how we did it and why we did it. I thought it might be helpful for those of you that haven't seen Grace Farms, see how we've converted and the genesis of the idea. So, so what you can see here is you can see Grace Farms, the river building. It's just floating along we're in New Canaan, Connecticut. And it was envisioned as a new kind of public place for people of all faiths or no faith, and to simply advance good together by providing these opportunities for people to experience nature, encounter the arts, pursue justice, foster community, and explore faith. And what you don't see here, but is at the threshold when you come in, is just the words grace and peace. And that is the real substance and the underpinning of what the place is about and is for all. But that's the, that is what inspired. So for my Christian faith and our Christian faith is what inspired Grace Farms. But it is, that is the extent of what you will really see in print at Grace Farms. But our whole team, our whole staff and our whole team is all comprised of many faiths. But that same underpinning of the idea to advance good together, looking to create a place of grace and peace for all. So I'm happy to report too that everyone on our 100-person foundation team is healthy, and we are working very, very quickly, boots on the ground with our partners to see this through. And so here's a picture of how we converted our place into a hub distribution relief center for Connecticut. You can see our team working with the volunteer New Canaan Fire Department to deliver boxes. And in some cases, literally within hours of the equipment landing on our site, the New Canaan Fire Department comes to Grace Farms every day around 5 p.m. to help mobilize this effort on the ground. And remember, they're already on the front line, so this is a double dip for them. And sometimes they're working till 11 p.m. at night. And then Personally, I've been on the phone with manufacturers in China placing orders to procure N95 respirators and other personal protective equipment. And we're working with the state, the lead procurers of the state, to coalesce around our data points and needs. And then I'm also grateful for the many, many people that we're jumping on phone calls, Zoom meetings, just this constant voice of, let's make it happen. And you can see it's this is what happened. Exactly. We delivered 1 million PPE. This is just 2 days ago. We were able to cross that threshold. It's pretty exciting, and I'll explain how that happened. I'll go through all this quickly so that then we can have time for questions at the end. But just to give you a little more detail, we, as of April 17th, did deliver 323,140 N95 respirator masks to the frontline healthcare workers and 664,400 additional pieces of PPE like surgical masks, coveralls, gowns, and gloves. And then 15,000 in there just because that's the coveralls that you wear from head to toe in the COVID units primarily. So we also, at this point too, also donated, let's say, 125,000 gloves to the state of Connecticut and supplied other N95s as well to the state to distribute. So you can see that it's really, it's been this local to global effort, which is also part of our DNA, where at Grace Farms, we pulled together the public, private, and government sectors to advance good together. So when you hear how we're talking with people, it's really pulling together all of the resources, relationships, and sectors together to make this happen. So even though we've delivered all of this PPE, in fact, we look at the number of 323,000 N95s. This is a combination of the NIOSH N95 and the European certified, the KN95s, and mostly they are the NIOSH, but this, it's still pretty terrifying. This is once what we started off to do was to be the stopgap measure so that we could we thought would be in a very short time frame, and now it's why it's extended to even a longer time frame, and given that there's such a dire necessity, and so now Connecticut is relying on us as a linchpin for these supplies for Fairfield County, New Haven, where we are at that epicenter. So it might be helpful if I just back up a bit and tell you how this did start, because we were not in this business, a month ago. We closed to the public on March 9th, and we did belabor that decision because we closed prior to probably any arts institution or cultural institution in the country. And we wanted to, again, it's thinking about community. We did not want to be a part of community spread, and we could see what was ahead. So we did close. I think that was also part of, there's so many divine intervention moments, which I could go into endlessly, but the fact that we did close early allowed for us to stabilize our own team. We have a team of 100 that, we were a private operating foundation, so we're operating our site. We have these 5 initiatives that we're working on locally and globally, but we paused. And then at this point, it was only on the 12th, 3 days later, after we stabilized our team, they were ensured that they had their jobs, that we moved right into immediate motion to start serving food. We have the commons in Grace Farms, serves delicious, sustainable, really affordable also food that we provide. And what we did is started to then immediately prepare and deliver food to our nonprofit partners. So that is continuing. That's also continuing as we are working on the PPE scarcity issue. And so we started with 500 meals that we were delivering to now up to almost 2,000 4 weeks later. So what we did in terms of the PPEs, we realized not only was there food scarcity, but we quickly realized that we need to apply our expertise, and if we could, to the PPE scarcity issue. So we have an experience in transnational supply chains. that are manifested in our justice initiative to combat forced labor. And now we're using all of these relationships to procure and expedite the PPE. And then also through our community initiative, that's where we coalesced a lot of these other local partners, including the New Canaan emergency management team and many others to fill the temporary supply demand mismatch. So you can see that, now I should also back up, like how did we step into it? It really did start with a commitment. You can leave it there, it's fine too. But we started, all the giving and all the serving does start with a commitment. So it was, even with Grace Farms, right? So that's a whole, like how that starts, a whole nother story. But in terms of this situation, our commitment is to community. And we wanted to, commit to the food service, but I was on a town, this is also on a town Zoom call, where the emergency management director was conflicted because he couldn't get the PPE that he needed just for our small town, because he said you need to purchase large volume PPEs, and we just don't have the funds for that. And so on the Zoom call, I made a commitment, which everybody, there's like 80 people on the call. And I said, okay, no, so Mike, and I don't even know him, but this is just on the Zoom call where you're starting to learn, right? You're getting to know our neighbors better, I think, or at least for me. I've seen a lot of that. We know our neighbors that we might not have had contact with. And in this case, I said, okay, Mike, we're gonna figure this out. We're gonna get the large volumes, not only for Connecticut, let's do that for the rest of the state. And then we exchanged our phone numbers on the Zoom call, and then that's where it all began. And that was on March 17th. So that was the one commitment. The second commitment, which I'll explain later, is through one of the doctors. So once I made that commitment to her, you don't turn back. So so you can so the thing that you'll see here too, this is really an example of like getting to the front lines. We did so with Senator Blumenthal and also Governor Lamont kindly, in the midst of all they're doing to manage this crisis, made a call out to us, and really just demonstrating a partnership that we have. And there's a lot of camaraderie now with us and the government to try to doing our part. They're working super hard as well, and it's we're able to also supply at cost to the state in some cases, and we've donated to them. That's or then we've I'll explain too how we've fanned out and where we're working in this in Fairfield County. So we're concentrating our distribution with 13 area hospitals. So you can see, rather than one particular area, we are really very committed to supplying all of our area hospitals, clinics in the whole state of Connecticut, and the local townships in the epicenter here, because that's where they also distribute not only to the first responders, but to the nursing homes and assisted care living, and they can manage in their own towns who needs what. So that has turned out to be very, very successful. And also, it's the ability for everyone to do their part. And they've said from the New Canaan Fire Department, this is one of the things that they're really most proud of, being able to serve the entire state, not just their own, not just New Canaan. And isn't that true that it's like serving your neighbor is where you can really derive so much joy? It's just, and seeing that on multiple levels. We're seeing that locally, and I can explain later. I know we don't have too much time, but it's happening globally in China. When I speak with the whole relationship I have with that supply chain is another story, but I have the ability now to have a relationship to pull together for this humanitarian effect. I mean, to be able to make this happen, and it's been really extraordinary. So let's see. So you can see here where we are, where we're serving in Fairfield County, but then we're also extending out to New Haven, and then also the full state of Connecticut. Then we have our neighbors next door in Pound Ridge and Lewisboro. So that gives you a sense of how we're expanding. And as of today, we are using all the social media platform that we have to ascertain input and in terms of, who needs what, which we didn't expect. That was the beauty of, we have a Facebook post that has reached nearly a million people, I believe, at this point. And we put into place a means to respond. So we have our whole team at Grace, the whole team, the marketing team is going through all of the posts to see who does need what. If somebody's requesting PPEs, that we can then respond to them and initiate a response form so that we can then in real time get those requests. Then our team also calls through them, and then we deploy even on the same day for supplies that are needed, maybe outside the Fairfield County region and up north. So today we're delivering to 2 new hospitals in Hartford and Bristol and Derby. And anyway, so we're expanding our efforts beyond, and we're bringing in other town, we're bringing like the local Chevrolet dealer who's going to offer vans. I mean, so it just really compounds. Everybody wants to get involved, and we're using all the wherewithal we have in our community and extending it out.
Sharon, do you have any military training in your background? Sounds like it's amazing deployment there of within 4 to 5 weeks to do everything that you did. I have one question as to you as far as what you've seen prioritization wise when it comes to the PPEs, between the masks and the gloves and the RDTs. Could you speak to that a little bit?
Yeah, so we hyper-focused on the N95s we feel like that was and know that it's the most technical and the most difficult to ascertain. And it's really that life-saving equipment that you need for those that are in the COVID units. They're risking their lives. You're all risking your lives. They're risking their lives on the front lines. And so that equipment is so important. All the others are less technical. So here, this is great. So this is an example. So you can see on the right is Dr. Teresa Bowling. She's wearing the coveralls, which are still important, but the masks. And then on the left, there's, is it St. Vincent's in Bridgeport? And the delight you see on her face for getting the mask. And I have umpteen texts, and because we're working in real time. So I have Dr. Teresa Bowling, she's an anesthesiologist repurposed for these COVID units. So she's telling me, like, for the first time intubating people, or she's helping, and she said, it's extraordinary. She's saying that I can't imagine using my N95 twice, because, it's like this is, and what happened is that I made that commitment to her. My friend said, I'm going to do everything I can to make sure you have a fresh N95 mask every day you go to work. And that's another thing I'm saying, like, in terms of giving, it's like making that commitment first, then after you have to figure out how you're going to do it. But in terms of like the military background is a really good question, because I do feel like people are wired to be first responders in a way, or not. So the good news is that the head of our chief accountability officer and head of our justice initiative comes from, he's a federal agent. He was head of Homeland Security. So again, all the pieces of the puzzle falling together to be able to respond are voluminous, but he's been able to also boots on the ground, get everybody to understand too, we are frontline workers as well. So we're on the front lines. We're a essential business at Grace Farms now. We've been assigned that to be able to serve. And so here we are, doing the same thing. And so I can also see, though, not everybody is wired that way. So I've been redeploying different people in different roles so that they can, you have you have to really, everybody has to use their own wherewithal. And if you're wired, you're like right there on the front lines with us. And if otherwise you could be, doing other things, but it's been pretty essential to have him. He's the linchpin really of our operation, because he has the whole transnational, even organized crime to understand like how to actually authentically, we're making sure that all the product is legitimized and inspected, and the whole process, we label everything as it should be. We make sure the freight forwarders are doing everything properly. So everybody that we're working with over in China is really adhering to all the laws and the ways that, the certifications, and it really has been, he's been able to work and usher in all the PPEs as well. So having the piece of puzzle, super important, Gregg.
Yeah, well, thank you. And as a resident of Connecticut, I thank you even further for all your efforts there. That's just really amazing. Just want to allow time for questions because they've come in. And again, Sharon, just thank you so much for your time and those efforts, which are definitely above the call of duty there. Just going to circle back to the Kims. I had mentioned there were some questions coming in around mental health that we want like to ask. That the pandemic has already highlighted an epidemic level mental health problem, and society-wise and patient-wise, you touched upon behaviors that also highlight mental health. How does the pandemic change, or does it change the way we treat mental health moving forward?
That's a great question. I think this actually highlights things that I think were already there. What we're noticing is that there are individuals who have already had a baseline history of either depression or anxiety, and all of this just heightened it some more. For anybody who's starting to show signs of that, that's never had that before, I usually try to figure out what the root cause of that is. And sometimes that root cause is simply need for information. One thing that we were told in New York City is, as a way to conserve PPE, was to not do any outpatient testing. And this was in the second week of March. But we also had a federal recommendation because of our grant funding that we were being told to test as many people as we could. So we tried to do both, where we tried to preserve our PPE because with the testing we were doing, we would be required to do full PPE from head to toe with the limited resources that we had, knowing that our colleagues at the hospitals were struggling too. So we were limiting what we could use, limiting the number of providers needing to get the PPEs done. One way we do that is limiting our testing to certain times of the day so that we're testing everybody at one time rather than spreading out throughout the day. But one thing we found was, even though the prevalence of coronavirus is high, the fact that people were tested and knew they were positive, it almost helped them in that information to know, okay, now I'm positive. I don't have to worry about whether I am or not. Now I know what I can do to help to make sure I protect my family as well as help myself get better. So I do find that having that information is so key to help all of us get through a lot of uncertainty.
Yeah, and I think, to just piggyback on Janet's, initial answer, a number of the cases we've seen, Janet was talking about different root causes. There have been a number of cases that have just been flat out spiritual, spiritual causes, and people just feeling this sense of loss of security, and beyond simply the mental, emotional, relational work that we're trying to do with these patients and their families. Our spiritual care team at Beacon has had an incredible amount of work because they've been reaching out to a lot of these families and just ministering to them. And it really doesn't even matter, where they come from. It never mattered before. Patients would allow us to pray for them no matter where they came from. But, just this last, couple of weeks, I've personally prayed with a Muslim, a Hindu, an atheist, and
Christian.
and some Christians too. This situation has actually been an incredible avenue and opening for us to be able to bring a real hope that doesn't disappoint. And I think people are at least beginning to consider it in the way that they just see us praying for them, and they know that genuine faith recognizes genuine faith, especially if they come from other faiths. They know that we're pretty, serious and genuine about what we believe. And so it actually, paradoxically, it seems, makes them more accepting and willing to see where we're coming from.
Yeah, hope seems to be in somewhat shorter supply for many people right now. Janet, back to you with another question. As a bioethicist, would you be willing to speak into the potentially tragic situation where ICU and ER professionals will need to be doing triage? We face that terrible question of life or death.
Yeah, I mean, it is a real situation. And again, these are situations that we do face, especially for those who work with older individuals. Pediatricians don't really face this issue as much. So this issue is always there, but I think in times like this, everything's just escalated to the magnitude and the numbers. I think one reason where this has been tough to address is that we literally went from 0 to 100 literally in hours or in days. So the ramp up time and the processing time, we were very lacking of that. But as I was thinking about, as a Christian and also from an ethics standpoint, how to approach a situation like this, one of my mentors and my first professor at Trinity, Dr. John Kilner, had written a book called Life on the Line. And his book, he talks about approaching ethical issues from a way of looking at it from a God-centered, reality-bounded, and a love-impelled viewpoint. And so you first start from the God-centered, right? And as us as Christians, and saying that, well, I believe that from a God-centered worldview, that every human being is of value simply because they are created in the image of God. And I start from there and say, well, okay, I have these resources, but they are of limit. So that's my reality that I'm trying to figure out how to work within. But I'm still going to be motivated by love no matter what I do. And so trying to apply that in that situations is one way to try to organize how to respond. Now, in some of these individuals that come to the ER, they may just have come to a point where no matter how many resources I have, they're already past a point of intervention. And that's a situation that's a very difficult place to be in, because we're always asked, hey, can you tell me how much longer can I live? And I hate being asked that question, because God can prove me wrong too. But there are individuals that we see that, regardless of age, that their disease might be more difficult to combat than in other situations. And so, but I found that by going back to looking at what Scripture says and how do we value human beings, how do we value one another, because Scripture does talk about that. And then looking at, okay, but we are living in a reality that there are limited resources, at least for the time being, until something changes, and making sure that my motivation is strictly from a love impelled, that I'm doing things that is honoring the patient that I'm taking care of, that is honoring and life affirming to the best of my ability, is one way to kind of guide us through situations like this that I hope is ones that we don't have to find ourselves in very often.
Yeah, well, thanks for highlighting that, Janet, especially the love response element that's so important. Just in the interest of time, I'm going to just wrap it here. If people would like to stay on after the call, we can hang out for a few minutes, answer some more questions. Take a look at the chat. You can get more information on Beacon Health as well as Grace Farms if you need some links. But just like to wrap us in prayer here, and then we can hang on for those that need to leave at 9. We can stay for a little bit. So. Lord Father, we just thank you for David and Janet and Sharon, Lord, and their amazing efforts and just inspiration they provide in a world right now, I think, that needs a lot of inspiration. Lord, would you just lift them up? Would you fill them with your Spirit and give them a shining and path in which to follow, Lord, and be examples, and to continue to give them the courage and the wherewithal to do what they're doing, Lord. For the rest of us on this call, Lord, I just pray that we would be able to walk in the spirit of generosity, Lord, to go above and beyond what we may feel like we're capable of doing during these times. Lord, I think of Janet's talk, about love and just how important that is, whatever we're doing, that we can demonstrate that you would give us that compassion, Lord, that fruit to be able to manifest when we're interacting with our staffs, when we're interacting with customers, Lord, that love would just come through and pour out of us. So, Lord, I just pray all of this in the precious name of Jesus.
Amen.
Greg, thank you. Janet, David, Sharon, thank you for bringing so much hope and healing to our community and our world. And gosh, I feel like sometimes these Zoom calls we wrap and we're done, but I feel like we could easily go another hour or more with just great questions and more inspiration. So deeply appreciate this. And we will send you guys some of the questions that we've received over the chat that we didn't get to. If you have a chance to respond to them, we'll kind of circle back on the feedback loop and let everyone know the answers to those questions. But again, so grateful for your time this morning, grateful for this community. I know we're all trying to figure out how we can make a difference in this season, and you all have given us some great opportunities to link arms and join together and leverage what God's given us. So thank you, everyone. God bless, and look forward to seeing you all hopefully next week.